Merrick, it's Dr. Buford, just getting started on the right shoulder. We're looking in from the back to the front. Everything that we see is magnified 30 or 40 times on the screen. You do have a rotator cuff tear, so we'll be fixing that, just like we expected to do. Your biceps tendon looks a little frayed, so we're going to get a free suture and fix the biceps as well. Also something else that we were prepared to do. The good news is inside the joint doesn't look that bad. Here's the anterior shoulder. The capsule and ligaments look fine. Posterior capsule. And then here's the rotator cuff tear. So really inside the joint we're just dealing with the biceps tendon, and then we'll be able to get to work on the rotator cuff. Now in order to deal with the biceps, I'm going to pass a needle right through the middle of it right there, and then we're going to take an instrument called the super shuttle. It's really just a wire. We're going to pass this through and then grab it with an instrument called the grasper. And then we'll take a stitch. And then in just a minute we're going to do this exact same process one more time. So we'll take the spinal needle again, and then we'll take the grasper. This time we're going to come through a little bit higher, right there. Relay. And this time we're going to feed a bunch of the relay into the joint. And we're going to go ahead and grab that relay with our grasper again. And then now we have a little trick. It gives us a stronger stitch. We're going to sneak around behind the biceps just like this before we retrieve this relay, and that gives us a little stronger hold on the biceps tendon so these sutures won't cut through the tendon. So in just a minute when we pull, you'll see what that looks like. Here you go. So here we'll pull tight, we'll move the cannula, and so now you can see how we have a good strong hold on that biceps. And next we'll cut it at its base. Okay? And so now we've already worked a little bit on the cuff. We'll go ahead and see if there's anything else we can do from this articular side. Pause, please. We're just getting ready to start fixing the rotator cuff. Just cleaning up a little bit so we can see. Okay, and so now we've got our guide in. This is the tear. This is the tear right here. That's the biceps tendon. This is anterior. This is posterior. We can look in and see the posterior extent of the tear. And now with this guide, we're going to place our first anchor down right about here. Okay, so if we get it down right about there, that looks like a good spot. We're going to mallet it down in position here. Inserter. And then we'll set the anchor. Feels very solid. We're going to go ahead and start retrieving these one at a time. So first we'll look and see what we have. We're going to take the black and white striped one first, just like that. And then from the left side of the screen, we can into our crescent suture hook and our grasper. Bring up a turn to the right next. Look underneath, make sure we're getting that deep layer. There it is right there. There, we'll go ahead and feed that relay through. And then outside your shoulder, we'll go ahead and load that black wire with the black and white suture that you see. And then as we pull back slowly, as you watch, you can see how it brings that stitch with it. And then comes out right through there. So we're going to go ahead and tie this first one, to give us a good anchor point. Do that just like that. And we'll show you some more in just a minute. Okay, so here we've got the first suture passed and tied right here. We're going to place a second one right about here, grasper. Give me a blue cannula, please. We're going to reach underneath, make sure we have a deep layer of the cup. Looks pretty good. There we are, coming through again. Okay, pause please. Okay, Mary, we're just finishing up here. We're putting in a total of 2 anchors and 5 sutures to fix the tendon, the rotator cuff tendon. We have a separate suture fixing the biceps tendon. And what we're showing you here on the screen is basically we're about 3/4 of the way through tying all of the sutures. We've passed them all, now we're just tying them all one at a time. And that's what you're seeing on the screen there. We're just tying these one at a time. So once we have that black and white suture over to the right on the screen that you can see, we've still got to tie that one. And then we've got one more blue and white suture to tie, and then we'll be finished. We'll go off on the video, show you some more in a little bit. Okay, so we're marching along here. I think we've still got one more to tie for the rotator cuff, which will be this blue and white striped one. Just wanted to show you that we're making good progress here. Finish this and show you some more in a minute. Okay, we're all done here. So as I rotate your arm, everything's moving solidly together. The bicep suture's tied in the front. That's that last white one on the right there. And then we've got 5 sutures lined up all the way to the back, holding down that cuff. So that looks very good. We're going to finish up, get you back to the recovery room. Good luck to you now. Bye-bye.